People are being entered into the webinar from the lobby, so I'm just waiting a moment. Still coming. All right, give it a couple more seconds and I'll get started. All righty. All right, everybody. Good morning. Excuse me. Good afternoon, everybody. My name is Maria Thacker-Gothi, and I'm President and CEO for Georgia Bio. As we come to the end of another week, I continue to hope that you and your families are safe and well, and able to get out and enjoy some of this beautiful weather we're at least having in the Atlanta region for those that are around here. Today, we're very happy. We're thrilled to welcome Senator Butch Miller and Senator Dean Burke to discuss what's happening in Georgia's continued response to COVID-19 crisis, how our industry can support their efforts, and any insights on what's coming next. The format is an hour in length, and this time will include time for Q&A. A number of people that registered submitted some questions, and we will be trying to get through as many as possible. I'll preface this by saying that if we will be ending on time, so if any questions go unanswered, someone from my team will do our best to get back to you directly and answer any questions via email or a separate call. That would be Joseph Santoro in my office. So before we get into it, I do have a couple of brief announcements to make. Tomorrow morning at 10 a.m., King and Spalding and the Global Health Crisis Coordination Center that was stood up about 8 weeks ago here in Atlanta will be hosting a back to work webinar. It is very much tailored for the life sciences sector, but it is a great opportunity for really anyone to hear from a world-renowned global health expert and Dr. Rob Bryman from the Crisis Coordination Center, as well as some top leaders in preparedness from the legal team at King and Spalding. So that's tomorrow morning at 10 a.m. and I encourage you to register in advance for that. I anticipate that being a very packed webinar. My second announcement is news that may have hit many of your inboxes this morning from Bio. Bio was excited to announce, and as the vice chair for the Coalition of State Bioscience Associations, I'm very excited to be letting y'all know, if you didn't know already, that Bio has announced their new president and CEO. As was announced a year and a half ago, Jim Greenwood was stepping down, and taking the helm will be a new leader, a new president and CEO for Bio. And I apologize, I literally just had part of my screen go out. Dr. Michelle McMurray Heath will be joining us. She is a former Harvard educated and coming to us from J&J. She's a scientist by heart, former FDA official, and the first African-American to graduate from Duke Medical Scientist Training Program. And now she's going to be leading the largest biopharmaceutical industry association in the world. So we're very excited. I personally am excited about, as a female leader, to see someone of her caliber stepping into this very important role. And considering that J&J is a longtime partner and one of the original members of Georgia Bio, we're very excited to see her coming from someone within our family. So I know on behalf of our industry and a number I've spoken to this morning from around the country, we're thrilled about her taking the helm of Bio starting in June. So if you haven't heard that announcement, I do encourage you to go to bio.org and check out that announcement and a video message from her. So with that, I'd like to pivot back to our webinar today and invite Holly Snow, who is one of our past chairs for our policy committee and the regional rep for Amgen, to make some remarks. We're very grateful to Holly and Amgen for sponsoring this afternoon's webinar. So Holly.
Well, thank you very much, Maria. I want to commend you and your team for putting this series of webinars together to keep us in touch with the happenings around the COVID. And in particular, I want to thank our senators on this webinar today for their time. And we couldn't be in better hands with Butch Miller and Dean Burke, and with their leadership and their expertise in healthcare issues. So I'm very confident that we'll pull out of this, and want to thank you, gentlemen, for being with us today.
Thank you, Holly, and thank you again for the sponsorships as we continue to put these on for the foreseeable future. I would like to now introduce Senate President Pro Tem Butch Miller, who has served in the Georgia Senate since 2010 and was elected by his colleagues in 2018 to this top leadership post. He represents the 49th District, which is comprised of the majority of Hall County. Senator Miller brings a wealth of leadership experience to his Senate seat. In addition to being a pillar in the Gainesville community, he is a former chairman of the Georgia Automobile Dealers Association's Board of Directors and the National Automobile Dealers Association 20 Group. He's also a past chair and president of the North Georgia Honda Dealers Board of Directors and the Georgia Baptist Children's Home Board of Directors. As one of the Senate's top lieutenants, he has played a key role in all policy decisions made at the Capitol. Senator Miller chairs the Administrative Affairs Committee and serves on a number of key legislative committees, including Committee on Assignments, Appropriations, Rules, Banking, and Regulated Industries, to name a few. With that, I'd like to thank Senator Miller for his constant support of the industry and the organization, and turn it over to him to make his remarks. Sir.
Thank you, Maria. Are we on? There we go.
Yes, sir.
Thank you so much for that warm introduction. I appreciate it very much. And thank you to Holly and Sally and others for having me on this webinar this afternoon, and just talk a little bit about what's going on in Gainesville and Hall County and across the state, not just legislatively, but medically, socially, etc. In Gainesville and Hall County right now, we're considered to be a hot spot. And of course, we had the great benefit of seeing Dr. Burke and others navigate, I guess, the pinnacle of the arc down in Southwest Georgia. And I think we are approaching that here in Gainesville and Hall County now. Of course, as many of you well know, that there's nearly 300,000 tests conducted across the state, and nearly 36,000 confirmed cases statewide, and 1,500 or so ICU admissions, and 6,300 hospital admissions across the state. Again, we had the great benefit of seeing Dr. Burke navigate what they were doing in Southwest Georgia. We had that benefit in Gainesville and Hall County. And we started, I guess, ringing the alarm early. And we believed that we were going to have that spike. We believed that we were going to have that COVID-19 pandemic peak. And we have had it, and we are currently experiencing it. We have a large segment of our population is Hispanic. A large segment of our population is living in multi-generational homes. A large segment of our population works in processing and manufacturing. And all those socioeconomic factors combined make it to be somewhat of a perfect storm for spreading the current and continuing the current health crisis. Even though employers were using the CDC guidelines and Department of Public Health Administration guidelines and so forth, people, those associates were going home from work and mingling with the rest of their family, mingling with the rest of their community, et cetera. So it continued to spread in Gainesville and Hall County, and we continue to see that happening now. We're very fortunate, very grateful to the Department of Public Health and the Governor's Office and others in that we were able to get some additional nurses. We ended up getting an additional 60 or so nurses in Hall County, about 8 emergency room docs, respiratory therapists, a number of other health professionals were able to come in and augment our current healthcare community here in Gainesville and Hall County. As we've worked through this process, and we're still working through it. We currently have a remote test sites set up throughout Hall County, Habersham County, Banks County, White County, particularly around the poultry processing plants. And we also have the Army Corps of Engineers and the National Guard building a makeshift hospital in the parking lot of our North Georgia Health Systems, Northeast Georgia Health Hospital here in Gainesville. So that'll be an additional 40 beds. And they're literally digging the footings and building a hospital. And it's like an anthill over there. It's amazing how much they're working, how effective they are, and so forth. As we continue to process through this, I think we're going to see that I've used the analogy a lot of times, coming out of this pandemic and opening up our economy and opening up social events and so forth is going to be a little bit like a sunrise. In a sunrise, every moment gets a little bit brighter. And in this recovery, every day continues to get a little bit brighter. We are continuing in Gainesville and Hall County and hopefully around the state. I know we're doing it in Gainesville and Hall County. Very prevalent wearing of masks. I've had other people around the state tell me that nobody's wearing a mask. If you go in the grocery store in Gainesville, just about everybody's wearing a mask. If you go in businesses in Gainesville, just about everybody's wearing a mask. And as we hear from the governor and he's loosening up or slowly reopening sectors of the economy with sanitation guidelines, there'll be certain divisions of state agencies and so forth that will be tasked with drafting health and safety guidelines and continuing to test to see where we are for new positives. So in Gainesville and Hall County, our new positives have tapered off. And we believe that at one time, we projected to run out of hospital beds on May 22nd and to reach our peak on June 15th. Because of the flattening of the arc, flattening of the curve, however you want to term it, we think that we will not run out of hospital beds and we will reach our peak prior to June 15th. And I think that this whole health pandemic and health state of emergency really spotlights the need for us to spend resources and focus on the healthcare community, on the Department of Public Health in general, on public-private partnerships, continue to implement the policies that help us, like telework, et cetera, and using resources to educate the communities across the state for best practices and prevention methods. We're having, early on in the conversation, you mentioned I was in the automobile business, and we remained open throughout the pandemic. We had 93 employees when we started. We had owned staff on the premises somewhere between 12 and 20 employees a day. We would typically sell 10 cars a day on average, roughly 200. We're open 25, 26 days a month, depending on how the month falls. And we average 250 cars a month. I don't remember in the last 10 years a day that we didn't sell a car until the last 45 days. And there have been multiple days that we didn't sell a car. And again, it's just a microcosm, but our business was off 90%, both in sales and in service. However, this past Saturday, we seem to have turned the corner a little bit. We sold 15 cars on Saturday, 5 cars on Monday, 4 cars on Tuesday, another 5 cars yesterday. And so we may be turning the corner a little bit from an economic standpoint. And the only way we can turn that corner on the economic standpoint is to first turn that corner on the healthcare standpoint. And so we have 2 new testing sites opening up tomorrow in Hall County. The hospital that the Corps of Engineers that I mentioned is opening up tomorrow. and we think that we will be ready for it. Again, I watched Dean Burke down in Southwest Georgia, Chuck Huffstepler up in Northwest Georgia. I watched the way those communities handled their crisis, and we were very fortunate to have, we benefited from their experience. So that's kind of my overview of it at the moment, and be glad to take questions or have some further discussion on any of those points. I'm a big fan of Dr. Toomey, of Brian Kemp, of Homer Bryson, of General Carden, and their team effort.
Well, thank you, Senator Miller. That was wonderful to hear. I really appreciate it. I'm sure we all appreciate the updates on the activities up in Hall County and that region. It's great to hear that the data is showing that y'all should have enough hospital beds, and your collaboration with the Corps of Engineers definitely promising, and as well as hearing about 2 new testing sites opening up. Testing is certainly going to be key as we reopen to keep the population safe. I want to turn it over now to Senator Dean Burke. Senator Burke is no stranger to this crowd, and with his expertise in healthcare policy, he's participated in a number of our webinars and public policy forums. Senator Burke has served in the Senate since 2013 and represents the 11th District in Southwest Georgia, which includes Colquitt, Decatur, Early, Grady, Miller, and Seminole counties, along with portions of Mitchell and Thomas counties. Senator Burke graduated from the Medical College of Georgia and received his specialty training in obstetrics and gynecology at Mercer University School of Medicine, and practiced obstetrics and gynecology for 27 years. He now serves as a rural hospital administrator in the role of chief medical officer at Memorial Hospital and Manor in Bainbridge. In addition, Senator Burke is chairman of Stratus Healthcare Governing Board and is an advocate for improving healthcare outcomes in Georgia. Senator Burke serves as the vice chairman of the Health and Human Resources Committee, Health and Human Services Committee, and is a member of the Agriculture and Consumer Affairs Committee, the Rules Committee, and Ethics Committee. He also serves on the Appropriations Committee and is in Community Health Subcommittee, its Community Health Subcommittee chair, responsible for 14.1% of the state's total budget. Apologies there. Well, Senator Burke, I'd like to turn it over to you.
Thank you, Maria. Can you hear me? Thank you. Well, I'm delighted to see and hear from my good friend Butch Miller, who does a great job as our President Pro Tem. And I'm amazed he didn't tell 4 or 5 jokes. He usually does, but I guess this is a little more of a serious environment, even for him. Do want to go over a little bit about what's been happening in Southwest Georgia and in rural Georgia, which is a little different environment than Metro Atlanta and Hall County. Obviously most people are aware that the incidence of the coronavirus infections has been in Southwest Georgia. If you look at the public health map and you go to the one that is per capita, you'll see the only red counties are in Southwest Georgia, and the density of infections has been localized here. Now, if you look at raw numbers, obviously Metro Atlanta leads the way with Fulton County, and I think Hall County is in the top 5. But again, from a per capita standpoint, most of the highest ranking ones are in South Georgia. And there's many reasons for that. A lot of people think the coronavirus was introduced in South Georgia from someone who came down here for a funeral that had recently traveled out of the country. And that funeral was well attended by several hundred people. And the cases kind of started from there, and that was when nobody really knew what we were doing. And I do think Butch is right. A lot of the counties that are seeing their spikes now have the added advantage of a public health system that's had 2 months of trial by fire, and they know a lot more about what to do and how to do it. And I know our hospital facilities, I'll speak briefly about a couple of them here. Phoebe Putney, obviously, because of their role in the Albany metro area, saw the brunt of this infection, and I can't say how proud I am of their ability to deal with the challenges. I've been a part of a chief medical officer group in South Georgia for since I've been in this role, so that's 8 or 9 years now, and we have always communicated with each other year round, because we have to manage doctors, and for those of you that ever been around them, that's not a easy task. So we are always exchanging information with each other and trying to figure out how we can keep our hospitals healthy and good results for our patients. But obviously those relationships paid off during this coronavirus crisis, from the standpoint of with my dual role as a senator and a physician leader. They came to me, those chief medical officers, with their problems, with their challenges, with their barriers, and with the relationships I built up in Atlanta with the different agencies, we were able to translate their needs into actions. And again, Butch mentioned the different leaders in the state, the governor, lieutenant governor, speaker, the agency heads, Dr. Toomey, Dr. Frank Berry. All of them have just performed wonderfully. And I'll also say, I'm a little bit lucky. One of the people in the White House, their liaison with state and local state and local elected officials, is actually from Thomasville originally. And William Crozier has always remembered where he came from, and he has been reaching out to us throughout this crisis, making sure that Southwest Georgia had the resources it needed on a federal level as well. So again, there'll be a lot of looking back at what we did right and what we did wrong, but I certainly, from somebody who's been on the front lines here in South Georgia, where our frequency of infections has been as high as almost anybody in the country, except for maybe New York City. And I feel like the response on both the state and the federal level has been excellent. The other things from the standpoint of the Butch mentioned the public-private partnerships. I mean, I think what makes America great is the fact that the government and the private sector work well together, and Georgia has always led in that front. I think most of our leadership in the last 10 or 15, 20 years in Georgia recognize the fact that we have so many great companies and talent in Georgia, and why in the world would we not utilize their knowledge and their resources and their energy? Again, Georgia Bio is obviously one of the leaders in that group from a healthcare standpoint. And, I think our greatest days are ahead, but I do want to thank you guys for all the work you're doing to make sure that the state has the resources it needs and the expertise it needs, because we can't do it without you guys. But I'm going to stop there, but be glad to answer questions.
Thank you, Dr. Burke. I appreciate you saying that. Actually, I don't know if y'all tuned into Lieutenant Governor's remarks with the Georgia Chamber this morning. They also acknowledged the importance of our industry. So thank you for that. And thank you for your remarks and your leadership as well down in South Georgia. So we're going to shift this over to some Q&A. I do have a lengthy list of questions, but I'll try and direct each one to each of you. And I'm sure this is going to get fun. So Senator Miller, how have they been handling the outbreak in Hall County? I know you brought this up. Is there anything else you wanted to mention that you may not have mentioned in your initial remarks?
how have they been handling it in Hall County in general? I would say that early on, people didn't take it seriously. I don't think that anyone realized the impact that this was going to happen. This was going to have on our community in general. And so I think that we got a slow start, but once we got folks engaged, and I think that early on we had some discussion about. I think that it's important for us to go back and talk about this as addressing this as a zip code by zip code or county by county basis, not a statewide basis. One size doesn't fit all. We were having hundreds of cases in Hall County, and there were other counties that had no cases. And so the same restrictions or I guess restrictions is the right word, that you would use in maybe Hall County to flatten the curve might not be right for Madison County or Morgan County or what have you, a different area of the state. So I think that going forward, we should think about looking at these types of things in a zip code by zip code or county by county basis.
Thank you, Senator. And I know this has been particularly close to some of our members, as we have a number of manufacturing sites in that region, in particular Regrow Pharma, I know up there. So Scott's been on our board, the manager there. So I know he appreciates your leadership there too. So Senator Jean, what has the impact of COVID been in rural communities?
Say that again. My phone's going off.
Sorry,
here.
I heard that too. No worries. It's a two-part question. I'll ask them both, but happy to repeat. What has the impact of COVID been in rural communities? Are smaller rural hospitals prepared for a COVID outbreak?
Well, obviously, it's been devastating from the standpoint of the economy and the personal stress that it's put on those families that are dealing with it and their loved ones. Loss of life, obviously, is something that's been a side effect of this. But even though about 1 out of 5 that's hospitalized has passed away, 4 out of 5 have been extremely ill, and frequently they're in a hospital environment where they're not able to see their family. And so, this has been, I think, and will go down in history as obviously just such a significant event and a game changer from the standpoint of so many parts of our economy and our society and the healthcare. It's funny that Butch mentioned the zip code by zip code on the healthcare. The first time I sat down with Brenda Fitzgerald when she was the commissioner of public health after I was elected, we were talking about the challenges in rural Georgia and healthcare outcomes. And I said the exact same thing to her then, and that's been 8 years ago. I said, we're not going to fix healthcare in Washington, D.C. or Atlanta. We're going to fix healthcare zip code by zip code because it is so different. The microculture of the people that live there, their disease processes, the incidence rates, you name it, it's different in Southwest Georgia than it is in Northeast Georgia. It just is almost like a different world. And until we recognize that, we're going to have some challenges. I will say from the other standpoint of rural Georgia, our biggest concern has been from the beginning with this pandemic is whether our resources, whether it's intensive care beds, respirators, hospital beds, emergency room, could be expanded enough to handle the spikes in need. And I can promise you, Phoebe Putney and I'm sure Northeast Georgia Health System both felt like that they were overwhelmed from the standpoint of the working 24/7 and their staff doing yeoman's work and going above and beyond. But that being said, and again, I was in touch with those folks regular when they were at their peak. They always felt like they had the availability of help, and whether that's from the National Guard, the state, the regional health systems that took patients when they ran out of beds. There was a response, and they knew they weren't alone. And so again, one of the things I think will come out of this is the importance of rural hospitals, like where I work, being available, because the regional health systems cannot do this by themselves. I know the 3 or 4 regional hospitals around us, they're usually on diversion when we don't have a pandemic, because they stay full. And so the rural regional hospitals have got to be supported so that these referral centers, specialty centers, can have the resources and availability to handle the complicated things that can't be dealt with in rural Georgia. So we've got to make sure that we have a robust rural health network, and it is going to take resources. The current economic environment in healthcare does not sustain rural healthcare delivery in the manner that it should. The business model is broken, and it's not sustainable. So the state and the federal government are going to have to put extra resources to keep those facilities viable over the long haul. And I think this pandemic has actually confirmed that.
Thank you for that, Dr. Burke. Just a follow-up, honestly, for either of you, how can our industry be more helpful in combating that? I mean, I would throw into, when I say our industry, not just those that are manufacturing a variety of therapeutics and even devices and PPE and things like that, but, you know, how can even the digital health community be helpful with that?
I'll jump in on that and say, well, we were talking about the budget earlier. We were thinking about the budget earlier, and I was thinking about the budget and healthcare and the implications with the healthcare overall with our state budget. I think that the integral thing that we need to remember is that we had proposed, or there was proposed, dramatic cuts in public health before this ever occurred. So I think we're taking a whole new approach, and your industry is going to be more important than ever. And I think that there's going to be a lot of sensitivity to it. And I think that the state of Georgia is going to be, we're going to come out of this much stronger on the back end, because we're going to be looking at healthcare with a new and intensive way, and hopefully funding it appropriately. I have to, by the way, I just give Dr. Burke accolades. I've told many people that upon his arrival in the Senate and hearing of his background, I knew that he was someone who would be able to help me navigate healthcare issues. My family, my father having been a rural physician, me seeing in our community how the challenges of rural medicine and of healthcare in general. And when we talk, the early Dean talked about the population a little bit in Southwest Georgia. I got a call from a senator here in one of my colleagues, and he said, "Why is it that y'all have such a lower mortality rate in Gainesville and Hall County? What are you doing differently?" I said, "It's not that we're handling a protocol differently. It's that we have a different patient. They're typically younger. They're typically more physically fit. They're typically more active. And for instance, versus the patients that Dean had in Southwest Georgia, I think many of them were an advanced age. They had underlying health conditions and a number of other issues that impacted the mortality rate across the state versus here in Hall County." So just wanted to add that.
No, that's great. And demographics certainly play a role. Dr. Burke, would you like to comment?
Well, yeah, I think, your Butch is exactly right. As I said, I think all of that data will show the demographic from the standpoint of the mortality data will show that the people that have the highest, most complicated health history are the ones that have the highest mortality rate. And I doubt there'll be a lot of differences except for that. I know from the standpoint of critical care, our physicians that are taking care of ICU patients have utilized the protocols and so forth that the CDC published and that were being used effectively in Phoebe Putney, because they'd had patients in their ICU for at least a couple of weeks before we had any in ours. So we had that advantage of knowing and learning from those folks that were already taking care of them. Now, from the standpoint of the industry, the biggest thing that I've learned in my time in the Senate in Atlanta is how important relationships are. Because at this point in time, generally speaking, when we run into problems, I have met somebody or have some contact, whether it's in industry or government, that knows somebody that knows somebody that can allow us to try to break down barriers that we run into. And so I guess from any recommendations to you guys, it would be, number one, thank you for the association that you put together to allow, whether it's a small company or a large company, to have access to state and federal government through the association. But the other part is just double down on your efforts to make sure that your folks are engaged, because who knows what need I might have that y'all may have a resource for that I don't know about at this point, because I've never met them and aren't aware of all of the things that is going on. So again, I think your particular association does a good job engaging with folks at the Capitol, but a lot of the things that are going on in healthcare technology right now in particular, I have learned so much just in the last year or so visiting the Georgia Tech and the different innovation and technology centers, and I've visited a few of your manufacturing facilities, but there's so many more that I've not touched yet, and some great work being done. And so we just have to continue that work to build those relationships.
No, that's great to hear. And just to reaffirm, we are here for you. If you have any questions or need access to anything, if I can't, I'll probably be able to find it. So please know that we're here for you as an organization to help bring any type of thought leadership.
Don't say that unless you mean it, because
no, I mean it. Trust me. And these times I mean
want
it.
Some antivirals, some vaccines, and rapid test machines. I'll go send you my Christmas list.
No, send me your Christmas list, sir. We, in all seriousness, we literally just stood up a Global Health Crisis Coordination Center, which had been designed over 12 months, and we're working with a number of your colleagues and a number of global health experts and our corporate partners too, to get some things off the ground. I'll follow up separately with that, but thank you for that and that affirmation for industry. I know there's so many things happening in Georgia. There are small companies like vaccine development happening at Emory and companies like GeoVax, as well as the plasma work happening between and the collaboration between Takeda and CSL Behring. So that's really important. So thank you. So let me dive into a few more of these questions. Senator Miller, we've heard the House wants to go back to session on June 11th, and Lieutenant Governor said June 15th. Can the House and Senate start on different days, or will there be a compromise on when session begins?
But actually, they can in fact start on different days, and that has happened from time to time in the past. And of course, as y'all well know, this audience well knows, we have been on many occasions. The Senate's been in on a day when the House has been out. The House has been in on a day when the Senate's been out. They've been in the morning, we've been in the afternoon, or vice versa. So that's really not a major issue in my view. And whether we begin on the 11th or the 15th, the fact of the matter is we need to go down there and get, the old phrase, get the people's work business done. We don't need to be arguing and quibbling over things that don't matter. We need to really, of course, I think we always have a very deliberative and very business-like approach, but even more so today. Georgians are hurting. Communities are hurting. Businesses are hurting. Families are hurting. It breaks my heart when I think about the families that out here in the state that lost loved ones during this period, whether they even, nothing to do with COVID. They didn't have the opportunity to have that closure maybe, or have that opportunity to grieve for that family member have that opportunity to be lifted up by people who love them. And that really breaks my heart when I think about families who've gone through that and continue to go through it. But whether we begin on the 11th or the 15th, I suspect that we will be very businesslike and very expeditious. I think we're constitutionally mandated to complete the budget, and to complete the budget, there are a lot of budget-related bills that we really need to bring up. But I think some bills that were, I guess everybody's, beauty is an eye of the beholder, and for instance, the bill that we have that is going to outlaw putting fish in a bucket and putting your feet in there to chew the dead skin off your feet. I doubt we're going to spend much time on bills like that. We're going to be spending time on bills that really impact Georgians. And I am hopeful that we will use our weekends as committee days. And we're going to be bumping right up against Father's Day. And I think there are a lot of families out there that need to be together at this time. And so I think for this 11th to the 15th, I think you're going to see a very deliberative and very business-like session.
Thank you. Dr. Burke, you want to follow up with a comment?
Well, no, I agree with what Butch said. I mean, I think most of us that have real jobs want to get in and get out. I do think the budget is number 1 through 9 on the list, and as he said, there's going to be a few other pieces of legislation that are important, and the from the sausage making standpoint is going through that process of people agreeing on which ones those are, and that won't be easy. It never is. So I don't anticipate that being not a dogfight. It always is at the Capitol, and that's okay. It needs to be hard. The other thing I think will happen is there'll be some meetings before the 11th or the 15th that some of these budget hearings, these are serious issues, and there will be some serious cuts to the budget. I was glad to hear the president say that that healthcare maybe won't be as slashed as much as other things. That remains to be seen. I'm a little bit worried about that because of the hat I wear on that budget committee, and the serious needs I see out there. I mean, we could spend a lot more money on healthcare right now in Georgia, and the idea that we have to spend 15% less just scares me to death. But that being said, we can't print money in Georgia. We don't have that ability like the federal government does. So anything that we spend on healthcare has to come from somebody else, and I certainly understand that nobody wants to give up their part of the pie. So it'll be interesting. It will be something people will be writing about for years.
Maria,
sure.
I like that.
Yes, sir.
Dean's comment there really brings around the thought that I had about, I want to share this with your audience and your group about Dr. Burke. Not only does Dr. Burke have the intellect to get down in the weeds of the budget and get down in the weeds of the finances in the state of Georgia, but he also has the compassion. And that is so very important in that budget process, that it's not just X's and O's and dollars and cents. It's lives, and it's impacting individuals. And Dr. Burke not only brings that keen intellect of understanding the budget, but he also brings that compassion to the table. And that's why he is such a key member of that, a key player in that budget process.
No, that's, of course, thank you. And certainly patient lives are the utmost important, especially from our perspective in this industry. And we thank you both, honestly, for both of y'all's compassion for that. Senator Miller, states have received and will be receiving more federal funds from COVID relief. How will this be dispersed in the state? Will that money be used to fill gaps in the state budget? And I realize this might be something that gets hashed out next month.
Well, I think Dean mentioned a moment ago that it's going to be a dogfight. And it always is when it comes to the money. The current federal funding streams have authorized funds for small businesses and employee benefits, and those sort of things. And then the large amount of the funds dispersed to the states for the coronavirus relief have been cost for state and local governments. And I think you're going to continue to see that approach. Georgia's share totals $4.1 billion and is currently ineligible based on the federal code and the U.S. Treasury guidelines. Mm-hmm. You can't backfill any revenue losses as a result of COVID. You can only use those for increased cost. And I think there's a big misconception out there about that. So you can't use it to backfill the budget, but you can use it to increase the cost. And so we're going to have to be very, I don't want to use the word creative in our accounting, but we're going to have to be very, very inventive and making sure that we apply every dollar possible. So.
Mm-hmm. And just to follow up, Dr. Burke, to that end, in your perspective, what major sections of the budget do you think will be affected by the ongoing COVID crisis? And specifically, we've got a number of questions on this. Will Medicaid be affected?
Well, again, I was on a call yesterday with the Hospital Association, and I felt like a spy because the speaker was speaking, and not sure he knew a senator was on the line. So somebody specifically asked him about Medicaid budget, and he said, the same thing that Butch said, that it's, kind of hard for him to imagine that Medicaid would be cut in a time when the needs in healthcare were so broad and deep. And that was great to hear, but he's only one part of that, and he's got a whole budget committee. And as I said, everybody that if we keep Medicaid whole, then that means we have to cut somewhere else. And everybody that has those budget subcommittees are very protective of their area that they're passionate about. I mean, if you're have a educator in your household, you're going to be trying to make sure that schools are well funded, and we have different business people in the Senate that have other interests, whether that's protecting the Department of Corrections, public safety. I mean, all of those are critical parts of state government. And so anyway, it's I guess there's a reason we get paid these really big bucks to make these decisions, it's because it is a challenge. And that was said tongue in cheek for people that don't know what our salaries are.
Well, thank you for that. And I don't envy you the many challenging decisions y'all have to make next month. Yes, sir. Oh, sorry.
Beg your pardon. Sorry. Go ahead.
No, you're fine. So this question is really to both of y'all. So Georgia ranks 49th out of 50 states on the cigarette tax, 37 cents versus the national average of $1.81 for a pack. In order to raise revenues, would now be a good time to increase taxes and implement a tax on vaping? Dean,
I don't want to take all the thunder, but I'm willing to comment on this, but I don't want to keep jumping. I don't want to keep jumping in front of you.
Well, since you said it, I'll go ahead and comment first. Then, I look at the cigarette tax and the vaping tax as a public health issue, and the data shows very clearly that raising those taxes decreases the use of cigarettes. I really don't like the idea of saying that we're doing this because the state has a budget hole to fill, because I think that's just wrong. We need to be doing it for the right reasons, which is, the more expensive tobacco products are, the less they're used, and especially for young people. Now, I also, am practical from the standpoint, I live in Southwest Georgia, and we've got two border states on my district, Florida and Alabama. And if we increase the taxes above those levels in those border states, then the people here will drive across the line because there's a convenience store, right across the Florida line, right across the Alabama line from my district, and people's behavior will change. So, anytime you make those tax changes, you've got to look at the big picture and the unintended consequences. You can't just say, okay, we're going to go to the national average, because the national average might mean people are pushed to buy their products in other states, and that's not good for Georgia. So again, I would vote for it if it comes to the floor, but I really think we just need to frame it in such a way as to realize we really are trying to save Georgia's health and the health of its children, and the uninsured that Georgia is already paying for because of bad outcomes, that will help that too in the long haul to decrease tobacco use.
Sure. Thank you. I would just comment that as a public health person by training, data-driven and health-driven is certainly something I'm personally passionate about. So I certainly respect that answer, but understand the challenges too. Senator Miller, any comments?
I agree with Dean. I will add that he brings up a great point about the border states. We're 35 minutes from the South Carolina line. If you raise the cigarette tax $1 a pack, then someone drives there and gets 10 packs of cigarettes in a carton. That's $10. I mean, you can see it. It runs them out of the state. Whether you go to the national average or a buck a pack or whatever the phrase was a few years ago. I think that we need to look at those expenses as healthcare issues, not revenue generating issues. And so I'm pretty much in agreement with Dean on that.
Certainly understand that. Yes, sir. So I've got a couple more questions and we'll close out in 9 minutes as scheduled. But public-private partnerships are crucial to a lot of things. Collaboration is key. But what unique public-private government partnerships have you seen form to combat the coronavirus crisis? Either of you. What unique public-private partnerships have you seen form due to the crisis?
Yeah. Well, a great example is over at Augusta University with the app they developed. And these public-private partnerships are going to be increasingly important, and we need to harness the horsepower, the minds, and the intellect, and the intelligence, and the entrepreneurship of the universities and of businesses, whether it's a bio industry or a biotech company, and harness those and implement those for the betterment of all of Georgia.
Mm-hmm.
Yeah, I agree. I think one of the things that's been so rewarding is to see a lot of businesses to pivot by what their regional needs were, and these companies that are making PPE and hand sanitizer and so forth, when that wasn't what they were doing 2 months ago, but they're producing like crazy with things like that right now. I mean, that's just amazing that Georgia and America has that entrepreneurial spirit. And I wouldn't want to start naming names because there's so many examples of that. And I do think that, as we get past this crisis, it certainly would be well advised, I think, for industry and government to sit down together and try to see what we could do differently. What we're pivot to at the end of this crisis, we're going to have so many learnings that we need to put down on paper and develop an improved pandemic playbook for the next time, because it might not be during Butch and our life, but we're going to have another pandemic. I mean, as a physician, I could just tell you it's going to happen again. And so it would be just such a missed opportunity if we don't, over the next year or two, spend some significant time and resources for us to see what we did right and see what we did wrong, and see where industry can partner in ways that we didn't think about it at the time, because we just, had too much going on. And, when the crisis is past, we will have some time to do that. We just have to take it.
That's great to hear. I mean, preparedness is certainly key, and is something that I hope. Well, I'm sure we're going to have more of a long-term memory on this crisis than we've had on other challenges throughout the years, and we're going to have to. Being prepared and having that playbook ready to go is important. Any other comments? I mean, we've had the surprising shortage of key drugs and PPEs, but any other ways you think we can avoid being in this place when the next crisis occurs? Either of y'all, Senator Miller, or anything else to say, Senator Burke?
On a very broad basis, I would say that hopefully this crisis will refocus energy on manufacturing and sourcing in the United States, not abroad. And if we had been sourcing in the United States, we would have been able to react quicker and take care of our own issues. And we had to depend on other countries who are not always, who have their own issues and their own agendas. And so hopefully this will make us more a renewed interest in manufacturing and processing.
Sure, and I would certainly say in our industry that is something that is top of mind for everyone in the life science, especially manufacturing space. And Georgia has a lot of attributes that other states don't have, in particular around supply chain. So that is something that if we can get the companies to, you know, consider us, we definitely have a good argument for that. If we can, you know, incentivize them in certain ways too. But I think supply chain is a big piece of it. So I'm going to go to a couple audience questions in the last few minutes, which one is a more practical question from I would say, actually, I think it's one of your constituents. Is companies reopen and due to, you know, of course, with the reopening plan from Governor Kemp, but if an employee does not feel safe going back to work, are they still able to file unemployment? Yeah.
Yeah.
I think it's the right question, but yes.
The unemployment issue continues to be fluid. There's a lot going on in that field right now. There is the issue of people not going back to work because they're getting more money at home. They're getting the federal stimulus, state stimulus, et cetera, and you know, and that's going to be a slowdown for our economy because people aren't going to want to work. I mean, that's just a fact. They're making more money at home on their unemployment than they're making in a lot of cases in their full-time jobs. But we've continued to struggle with and bounce around with the issues around unemployment. And there are three categories that come into play there. One is that you have if you're called back to work and you don't come back to work, if you're called back to work and you say that you don't feel safe coming back to work, and then you know, people still have to pay their bills. Partial unemployment has been the brunt of most of the claims. So people always have an option, and for at least right now they have one. There is an emergency paid leave provision to the First Relief Act from Congress, and that allows folks who are unable to return to work to take extra sick leave. But at some point, they've got to go back to work. That's just all there is to it.
Yes, sir. Well, I think there's just one quick one. We have 2 minutes left, and I'd just like to say, you know, important organizations that the state already invests in, like the Georgia Research Alliance, could really boost Georgia as a place to be and a place for innovation. I mean, what do you see as the future of GRA, if, you know, you're comfortable speaking candidly on that right now?
Yeah, no, that's exactly one of the organizations I was trying to, you know, in my ancient brain, pull up the acronym. I couldn't pull it up while I was talking earlier. I think it's, again, we are so lucky to have, you know, those kind of organizations already. And I think the payback on investing in that sort of association is just tremendous. So yeah, I think, again, we just need to make sure the dialogue continues from those of us in the state government and the business leaders to see what we can do to grow that. I mean, we've had in healthcare, I'll be very brief, but you know, we've had medication shortages, fluid shortages, things like that for the last, you know, 8 years. This is not new to COVID. COVID has brought it to the forefront in the media, but it's been a problem for a long time. So anyway, I would just say we need to get our best and brightest to study that and try to come up with some solutions. And I'd certainly love to be part of it.
Well, thank you for that. And we're at time, so I would like to thank you, gentlemen, and just ask you any last comments before I close this out.
My last comment is that I've got a 2 o'clock conference call.
Well, I'll let you get to that. And please know that Scott Rizzo at RECRO texted and says, open door policy, he'd love to give you a tour of his site. And so just letting you know, Senator Miller. But with
please
that,
ask him to give me a buzz. Ask him to come.
Ask him to give you a buzz. We can do that. And Senator Burke, any last comments?
No, thank y'all for inviting me to speak, and just know you have a friend at the Capitol, and if there's anything that I can do to help you, we'll be there for you. Okay.
Great. Well, thank you both, and we wish you well. And one last reminder for our attendees, please join us tomorrow at 10 a.m. for our Back to Work webinar, and visit our sister site at globalhealthc3.com. And just remember, we're here for you, and thank you to Amgen for your support, and we look forward to connecting you in our next webinar tomorrow, and some more next week. We have a supply chain logistics one next Friday we're about to announce. So with that, be safe, be well, and see you soon.
Thanks so much.